Next we will invite Dr. Resmina.
Good evening. Today I am going to present my paper titled Central Corneal Thickness Using Anterior Segment Optical Coherence Tomography versus Ultrasound Pachymetry. Corneal thickness is a sensitive indicator of corneal health, and we have several methods available to measure the central corneal thickness. Ultrasound pachymetry is the gold standard in this. It is a contact procedure which uses Doppler effect. It is easy, fast and convenient. Anterior segment OCT is a non-contact, non-invasive method that works on the principle of interferometry. In India, we have only few studies to compare the CCT measurement using ultrasound pachymetry versus ASOCT, so we proceeded with the study. The aim is to compare central corneal thickness measurements using ultrasound pachymetry and anterior segment optical coherence tomography. It was a hospital-based cross-sectional study conducted in 120 eyes of 21 to 50-year-old patients. We have excluded those with corneal diseases, previous ocular surgeries, on regular topical medications, ocular infections and diagnosed glaucoma patients. And detailed examination was done and CCT was measured with ASOCT twice, followed by ultrasound pachymetry thrice. And in ultrasound pachymetry, each time we get an average of 5 readings. Descriptive statistics were calculated for both the categorical and continuous variables. And the categorical variables were expressed as frequency and percentage. And the continuous variables were expressed as mean, standard deviation and range. A paired retest was done to determine if there was any change from one measurement to another. And the all data were entered in MS Excel sheet. And the analysis was performed using Jamovi 2.5.3. The age distribution of the study comes between the range of 21 to 50 with a mean of 35.2 plus or minus 8.8 standard deviation. Out of the 120 patients, it is slightly skewed towards female. That is 67 was female and male was 53. This is what's showing in pie diagram. The data shows that the CCT measurement using ASOCT falls between the range of 428.5 to 590, and it is a broader range with a mean of 527.3 plus or minus 28.6, whereas the ultrasound pachymetry has a slightly higher mean of 533.9 with a standard deviation of 26.3. Compared to the ASOCT, it has a shorter range of 459.3 to 611.7. This is the box plot of the same. The paired difference analysis shows that the ultrasound pachymetry consistently provided a higher reading with a mean difference of 6.64 plus or minus 14.3 microns compared to that of the ASOCT. That means it is a statistically significant one with a p-value of less than 0.001. That is, the disparity between the two measurement methods is unlikely to be due to the chance. So the ultrasound pachymetry tend to overestimate central corneal thickness compared to that of the ASOCT. So coming to the discussion, the constant underestimation by ultrasound pachymetry may be attributed to the differences in the measurement principles between the two techniques. Ultrasound pachymetry measures from the anterior corneal surface to the posterior corneal surface, including the tear film, whereas the ASOCT usually excluded the tear film. That may be the reason for the slightly lower readings. And also the ASOCT provides a better measurement centration and perpendicularity than ultrasound pachymetry. And also it may be due to the different location of the respective reflective interfaces in the cornea and due to the differences in the principle as we have already mentioned. The ultrasound pachymetry works on the principle of time of flight principle, and the corneal thickness is measured as transit time into propagation velocity divided by 2. So the accurate measurement of the propagation velocity of the sound in the cornea can complicate the calculation of the corneal thickness. ASOCT, it is a faster one. It is a non-contact, so it reduces the risk of infection and corneal epithelial damage. It can simultaneously measure other anterior segment parameters and suggests that the ASOCT could be a valuable alternative for central corneal thickness measurement in clinical practice. However, the clinician should be aware that the slight systemic differences between the two methods and should consider in situations like certain refractive surgery calculation, this bias should be taken into account. So to conclude that the use of ASOCT is can be considered as a reliable method compared to that of the ultrasound pachymetry for central corneal thickness measurements. There may be a slight underestimation by ASOCT which are consistent with the previous findings, and clinicians should be alert regarding the difference in CCT values using ASOCT and ultrasound pachymetry, and always try to interpret in the context of the instrument used to measure it. Our study does not compare the CCT measurement in each age. We have more number of female patients and the study population is small, and we have the signal strength of the ASOCT should be ideally more than 9. These are my references. Thank you.
Usually you would expect the ultrasound to give you a thinner value compared to ASOCT because you have a tendency to compress. No? So why do you think it's showing thicker value?
Because of the tear film.
Tear film is for the ASOCT, not for... this cannot subtract the tear film. What else happens in ASOCT which doesn't happen in ultrasound pachymetry? What is the first step?
ASOCT, it gives measurement from each of the layers.
So all of us have to invest in ASOCT now for measuring pachymetry. That is what you are recommending.
Ideally, because the ASOCT is a non-contact procedure, so it is better compared to ultrasound.
You also have orb scan in your hospital?
No.
No. Okay. And supposing you are off center for the pachymetry, you are not centered. Will that show a thicker value?
Yes.
Why didn't you mention it? As you go towards the sclera, the corneal thickness will increase or decrease?
Increases.
So if you are off center, it will increase. Are you dead center in the ultrasound?
It's all centrally measured.
So who measured it?
No,
How are you sure that you measured it on sit lamp or on the chair?
on the chair.
So you will not get center in you should be center in the pupil. You should measure it with the pointer with the probe attached on the sit lamp, then go and touch and come. Right in the center. If you are little off center, it will go at thicker value. No?
Okay, thank you.